We were just running a regular drill on the 8, and we were passing, and I was about 10 feet away from one of my teammates, and she threw the ball. And I had my stick up. I don't know why I didn't catch the ball, but it just hit me. The ball hit me here.
Risk comes with being an athlete. It's part of what makes sports challenging. Sometimes there are injuries, but there are unacceptable risks as well, especially when they involve possible brain injury. Continuing to play with a concussion can cause permanent damage or even death.
No matter what you do, whether it's making sure the equipment fits properly, playing by the rules, or really following every guideline, sometimes you cannot prevent the first concussion. It's not the first concussion that's the problem. It's playing with symptoms from the first concussion when the brain is vulnerable that sets a youth athlete up for more serious injury.
Only hours after his first injury, Gary returned to play. He didn't know he had a concussion.
I didn't feel that too bad, but as I was playing, and then I went to tackle a running back, and he kind of hit me in the head with his hand, and I remember I was just getting up, and I totally going back and forth. So I pulled myself right out, and then that's when the sports med guy diagnosed it as a concussion.
In one study of catastrophic head injuries in high school and college athletes, most of the athletes suffering devastating brain damage had a history of a previous concussion, and most of those previous concussions were in the same season.
In one study, almost 40% of athletes who had a serious brain injury were playing with symptoms from a concussion. It's important to rest, to stop until all signs and symptoms of a concussion are gone before there's even a thought about return to play.
UW-Medicine physician Dr. Stan Herring is co-director of the Seattle Sports Concussion Program. He works closely with coaches and athletes on all levels, both youth and professional.
If a coach suspects a concussion, it is critical that he or she remove the athlete from play.
Part of the problem is that teens may hesitate to report symptoms, believing their injuries are no big deal, or trying to tough it out and return to the game. There may even be pressure from parents or other adults to keep playing. During the long recovery from his second concussion, Gary felt uncomfortable with his teammates and even an assistant coach.
I remember one coach actually before game, he wasn't the nicest coach, but he was going to the injured people, and he was going to talk to them, and then he came up to me and he's like, you know how long you've had a concussion for? I was like, yeah. He's like, out of all my 15 years, you've had the longest one. I was just kind of like, oh, thanks. It really made me feel bad, and because I couldn't control it or anything. And but yeah, from teammates, they didn't really understand. Sometimes I heard from some people that they thought I was faking it to not play, and I was just thinking that I'd play if I could play.
Well, coaches can face a lot of pressures from athletes themselves, from parents, from administrators, from other coaches, and so it's really important for them to remember that they're part of the healthcare team that is protecting these athletes, and so they need to recognize those symptoms and take the kids out of the game.
In the state of Washington, there is a law to guide coaches and adult supervisors. It states that a youth athlete who is suspected of sustaining a concussion or head injury in a practice or game shall be removed from competition at that time and may not return to play until the athlete is evaluated by a licensed healthcare provider trained in the evaluation and management of concussion and received written clearance to return to play from that healthcare provider.
The Lystet law is great in the fact that it backs up the coaches and it gives them the power to say this kid needs to sit out and he cannot return until he gets written clearance from a healthcare provider that has been trained in the recognition and management of a concussion.
Return to practice or play is a medical decision. That's not new news. We've known that for over a decade. The Zachary-Lystet law just makes it simple. It's no longer a suggestion, it's the law.
It is absolutely essential for coaches to take the lead in recognizing a possible concussion to prevent potentially devastating brain injuries.
The partnership between coaches and the healthcare community is an essential part of the Lystet Law.
The coach serves as the first line of defense in the healthcare team of identifying a concussion. They're the ones that know the athletes the best. They are the ones that have spent the time and have the trust of the athletes. And so the athletes are a lot more likely to come to them, and the coaches can recognize when the athlete is not acting normally or is having a problem or experiencing some type of symptom, and so they can pull them out right when it happens.
When you take a blow to the head or to another part of the body with force transfer to the head, there can be a rapid onset of signs and symptoms which can be quite variable. In technical medical terms, a concussion is described as a complex pathophysiological event to the brain that's induced by trauma. What does that mean? Complex, first of all, it's a complicated cascade of injury to brain cells and to the blood supply of the brain. Pathophysiological means it's not structural. It's a software problem, not a hardware problem. The brain looks normal on a CAT scan or an MRI, but the brain does not function normally.
Friday night, I was mostly just worried about my face because that was the most painful part. And then Saturday and Sunday, I started feeling really out of it and really just kind of dizzy and really sensitive to light and sound. And like I said, riding in the car was really hard, just bumping and like all the sounds. It was awful. And I had to close my eyes, and I remember holding on to everything, and I was like, I can't do this. And Sunday night, I felt even worse. It felt like the headaches were getting worse. And so my mom decided on Monday, like we should go see a doctor.
Concussions can happen during any sport. As a coach or an adult supervisor, you're the first person to evaluate an injured player for possible concussion.
I remember after the first practice, I went into the locker room and I felt just kind of like dizzy. It was no contact or nothing. I just felt dizzy. And I even asked my friend, I said, I think I took like too many Advil or something because I made me really dizzy. And so I didn't think it was a concussion at all because I had one earlier and it was like a boom impact and I had one.
For coaches, since they know the athletes so well, the most important thing for them to look for is just a change in how the athlete is behaving from normal. So they just might have some slight change in personality. They might normally be very friendly and outgoing, and now they're more reserved, more angry, something like that. They can be experiencing headaches, nausea, they could be vomiting, they can have some problems with their balance, or maybe even remembering plays, or they're having sensitivity to light, sensitivity to noise. We're just going to do a quick assessment and see how you're doing today, okay?
There can be many signs and symptoms of concussion. They vary depending on what part of the brain is involved, and sometimes they can be subtle. Only about 10% of athletes will lose consciousness. Symptoms of concussion are what players tell you they're feeling. Signs are what you observe in an athlete. Athletes may report these symptoms: headache, pressure in head, nausea or vomiting, neck pain, balance problems or dizziness, blurred, double, or fuzzy vision, sensitivity to light or noise, feeling sluggish, feeling foggy or groggy, drowsiness, change in sleep patterns, amnesia, not feeling right, fatigue or low energy, sadness, nervousness or anxiety, irritability, more emotional, concentration or memory problems, confusion, repeating the same question or comment. Signs may include these behaviors: appears dazed or stunned, vacant facial expression, acts confused about assignment, forgets plays, is unsure of game, score, or opponent, moves clumsily, answers questions slowly, slurred speech, loses consciousness, shows behavior or personality changes, can't recall events prior to hit, can't recall events after hit, seizures or convulsions, any change in typical behavior or personality.
So the first balance exercise, you're going to have your feet hip-width apart.
Signs and symptoms of concussion generally show up soon after the injury, but the full extent of damage may not be apparent at first.
After a concussion, an athlete may seem slightly dazed or confused, but a half an hour later, they might not even remember coming to the stadium. So assess the athlete, assess them again, and assess them again. Observe that athlete for at least 1 to 2 hours after they've had a concussion.
When in doubt, sit them out.
Even the suspicion of a concussion requires that the coach remove the student from play. The next step is for a licensed healthcare provider who has been trained in the management of sports concussion to evaluate the athlete. Tilden Keller, an athletic trainer with Seattle Children's Hospital, works closely with coaches and athletes, often on the playing field.
Okay, Marco, based on your symptoms and the results from this SCAT2, you have a concussion, okay? And so what we're going to do is sit you down on the bench. You're going to sit there, we're going to monitor you, okay? And then I'm going to go talk to your coaches and we're going to have a discussion with your parents about what's going on, okay?
If no medical personnel are available on site, the coach or designated person needs to decide whether to call for transport to the emergency room or whether to send the player home with adult supervision. Either way, the law requires that a licensed healthcare provider determine when or if to return an athlete to practice or play.
No longer is a coach required to be both a coach and a healthcare provider. No longer will a coach have to bend from pressure from an athlete or from an overbearing parent. Return to play after a concussion is a medical decision.
The long-term effects of a subsequent blow or blows to a concussed young brain can be catastrophic.
So second impact syndrome is when an athlete has suffered a concussion and they return to play too soon. So they have not fully healed, their brains haven't fully healed, and they return into play and receive another blow. And that can result in second impact syndrome, which is rare, but it can result in very catastrophic consequences and even death.
Young brains heal more slowly than those of adults. Rest, minimal physical exertion, and sometimes reduced schoolwork are essential. Returning to sports and other regular activities too quickly can prolong recovery time, sometimes for months.
Concussions are not only going to affect an youth athlete's sporting life, but it's also going to affect them in the social setting, in their academic setting, in the home life. Their symptoms can cause them to have a hard time concentrating at school, have a hard time doing their homework. It can increase their symptoms with increased mental strain. And it can also be very difficult for them to spend time with their friends or family.
Gary went back to school a week after his concussion. It was far more difficult than he expected.
When I got to school, I felt a little, not too bad because I've been resting and everything. But when I got to school and we got to start learning and stressing the brain, that's when it started picking up even more. So I didn't think that school would affect it at all, so I just played it out regular. But that actually made it a lot worse.
The time it takes to recover is difficult for everyone. For Gary, he's still not cleared to play after a year. For Molly, recovery took 4 months. It felt like a very long time.
And I was so frustrated and so irritable and just anxious all the time because I couldn't work out. I couldn't do school at all. I wasn't able to go to school. I wasn't even allowed to use the stairs at school. And even sitting in class was really hard because the lights and having people read to me made me feel nauseous and sick. It was awful.
After missing an entire lacrosse season as well as her summer soccer club, Molly's excited to return to play.
Yeah, I've had a sport every season since I was 8. And then all of a sudden I just had to go home and sleep and do nothing. And it was this is so weird. I miss going to practice and practicing and being on a team and all that.
The Lystat law makes sports participation safe for all athletes. It's simple. If there's a suspected concussion, take the athlete out. If we do this, we will prevent tragedies like the tragedy that happened to Zachary Lystat.
Just play it safe and trust that what you feel is actually real, because sometimes people even accuse you of being fake. But just know that it's a serious injury and it's just rest and do everything that the doctor says to get better.
When in doubt, sit them out. Stand tall, make the call.
For more information about concussions, visit the Washington Interscholastic Activities Association website at www.wiaa.com. Additional information is available through these websites.